So, what is it like to be back to medical school after a gap? Um, Pretty much, if you work hard enough and do the work, it pays off. Um, yeah, God will help you concentrate, exercise, have faith, and just keep working on it, and He will do well. You'll be right where you need to be. So it's possible. Yeah, for me, I had medical issues. I took a medical leave. When I was trying to go back, I had already passed a course in a block, so I was now part-time. So I couldn't get FAFSA financial aid anymore. So that totally screwed everything up, messed up everything for me for medical school. I had to leave, go back to US, go back home. I tried to do other programs so that I could make money and come back to med school. It took a while. I went to a program that didn't work out, in pathology assistant program. My grades turned good, but there were other like issues of the clinical side, discrimination really, where somebody said that I'm unteachable, this and that, but my school didn't do anything about it. It was Eastern Virginia Medical School, but that was totally discrimination. Somebody saying I cannot learn anything. I mean, clearly I can. I have a bachelor's in science, double major. I have a master's in biotechnology with biodefense, and I was just trying to get my master's in pathology assistant. That didn't work out. I was near graduation, There's a lot of bullying against Black people. I heard about that in nursing, but not just nursing, but in sciences. So I ended up going into nursing, where I'm glad I graduated. I got my master's in nursing. It's raining outside, so it's getting really loud. So during that program, I really liked the school. The professors were great, but some people are not very happy that we were entering as master's students because it took them a while as nurses to get their masters. But you know what? We did our bachelor's. We were concentrating in nursing. It's not like we just didn't do anything to gain the masters. We had done a lot of bachelor's of science work before we even applied for the master's of nursing. So we were not getting it any faster than I guess somebody that goes from their BSN in 4 years and straight into their master's. We did 4 years of college already. But anyway, some people will be mad about it. Some preceptors might try to take it on you, but thank God I finished all my clinical rotations for nursing, graduated as a nurse. Then I started to work as a RN. I was so excited. I worked on the cardiology floor. I never thought I would be working so fast, but it was so fast, but it was a good floor. I liked it, but there was some nurse bullying on the floor. And if it's coming from a preceptor during orientation, that's just a sign that things might not work well for you on that department, and they did not work well for me. So I left. I was trying to work as a nurse for a while before I paid for med school and come back, but I ended up coming to medical school sooner, coming back. I had left medical school years before, and I was in term 4. I was lucky to apply to Windsor University School of Medicine in the Caribbean, and then I was able to continue from term 4 of med school where I was. Remember, before I took the medical leave, I was in term 4. I had finished one of the blocks called Reproductive System and Endocrine. I had finished that one, so when I came back, I picked up to the next blocks because luckily they had a systems-based curriculum. So I was able to finish term 4, and now I'm in term 5. And believe it or not, after term 5, it's really starting for step 1. Wow. Yeah, and yeah, I'm looking forward to being a doctor And I'm also working on advancing my nursing into nurse practitioner, because I did not have the best experience as a bedside nurse. No, I did not. So I'm trying to get my nurse practitioner work done so that I can work as a nurse, get some finances, finish paying for medical school, and then be a doctor. I mean, who knows? Even if it is a physician, maybe later on, way later, when I'm tired, working the physician hours, I will work as a nurse practitioner more full time. Way later, maybe towards retirement. But for now, I'm active, so I want to work as a doctor. I want to go through the whole process. Lord willing, if Lord gives me strength. I mean, I used to be sick. I used to have 10 out of 10 pain when I was in med school. And now I'm well, older than I was, but feeling better. So anything is possible in God. So you can do it. Happy Nurse Week. And glad also to say you can be anything. You can be a bedside nurse, nurse practitioner, a nurse anesthesiologist. So you can be anything you want to be. You can be a doctor, you can be a scientist. There's so many opportunities for nurses. You can be a research nurse. But anyways, happy Nurse Week, and keep up the good work. I do love nursing. I started as a caregiver, when I was doing my pre-med, because I was always pre-med trying to be a doctor. When I was doing my pre-med, I was always working as a caregiver when I was doing research as well, like research assistant or research tech work. So as a caregiver, I was exposed to some nurse work, and I was working under some nurses, So yeah, that was my pre-med thing, always doing caregiving work, and I love it. I still love it. I miss those old ladies and old guys that I worked with. So anyways, that was being like a nurse assistant, right? Being a caregiver. So I've always loved nursing, and it helps you be a good doctor too, because you're used to working right next to patients. It can help you as a nurse practitioner too, because you're really working directly with the patients. So whatever type of nurse you are, yeah, it's good. It's good. Whatever work you're doing at the bedside is awesome. I really loved bedside nursing, at least for cardiology. It was a lot of work, but there's a lot of stress on the floor, and I feel like sometimes people take it on other people. They take it on other people, and they are not patient, and they might miss what you're doing, and then yeah, it just wasn't for me. But I love it. Maybe I'll enter cardiology as a doctor. Who knows? I don't know. We'll see. Anyways, God bless you. Happy Nurse Week. Bye. God bless.